We continue our story about a Bay Area anti-aging clinic. It's a clinic that is diagnosing medical conditions and prescribing drugs to patients, but there is no doctor on site. How do they do it? Hank Plant brings us the conclusion of our hidden camera investigation.
Meet David Regalia. He's not a doctor, but he runs Preventive Medicine of the Pacific, an anti-aging clinic in San Francisco. Regalia seems to live the good life. He travels and drives a car worth as much as $80,000. As for his occupation, he sells the Fountain of Youth. A 5 Investigates producer went undercover to find out what Regalia can do for her.
I had put on about 10 pounds a year ago that I just couldn't lose.
Regalia says he can help.
How long does it take for the body fat to decrease? Wow, a couple of weeks.
Regalia tells her she needs to exercise, eat right, and replenish her hormones. First, she'll need a blood test. We showed the results of that test to San Francisco hormone specialist Dr. Ellen Rubin.
You have perfectly normal blood test results. You're in good health.
Not according to Regalia.
I can't believe my levels are so low.
Watch what Regalia does on our hidden camera video when our producer goes to see him. The blood work shows that our producer's level for the hormone DHEA is 170, well within normal, which, according to the lab, ranges from 35 to 430. But Regalia writes in his own normal values and tells her she's deficient.
You changed the values on her blood work.
I did not change the values on her blood work.
You didn't write
no.
On the paper?
No, I can't do that.
He's changed the normal values. It's ridiculous.
Regalia even says some test results are irrelevant.
We treat patients' symptoms. We don't treat numbers on the piece of paper. In other words, just because the blood panel says the patient's okay, but if the patient is still exhibiting all the characteristics, we will treat the patient.
And that's exactly what Regalia told our producer. Her blood test shows that her thyroid is perfectly normal, but Regalia says she needs 4 hormones, including thyroid.
Blood doesn't lie. If a blood test says you have hypothyroidism, then you've got it. If it says you don't, you don't.
Dr. Rubin says too much thyroid is downright dangerous.
It causes your heart to work much more rapidly. It can cause the heart to fail. It certainly decreases bone. Too much thyroid medication causes thinning of the bone and osteoporosis. It makes you feel jittery.
Regalia never took a family history, but he did insist on a physical examination, if you can call it that. That took place in the conference room of a law office. A physician's assistant checks our producer's blood pressure and listens to her heart through her clothes. He can't check her pulse because he doesn't have a watch. Now, all she has to do is promise to pay Regalia a $650 medical/consultant fee, plus the cost of the medication. And her hormones arrive by mail.
And they come back for the second consultation where they meet with Dr. Neitzes.
Do your patients always wind up meeting with a doctor?
Oh, yes. You have to.
But that wasn't the case with our producer, Robbie Peel.
She met with the PA, Tony Grattan.
Who did kind of a cursory exam, didn't even have her clothes off, just...
He did an abbreviated physical examination.
But even though our producer never saw a doctor, there is a doctor's name on her prescriptions, Dr. Neitzes, who's listed as the clinic's medical director. It turns out Dr. Louis James Neitzes doesn't specialize in hormones, and he's not even in San Francisco. We caught up with him as he wrapped up his shift as an anesthesiologist in Sacramento.
You gotta be kidding me.
I'm not kidding you. There's a prescription here with your name on it. You've never even seen this patient or even talked to her on the phone, Robbie Peel, through the clinic. Anything you want to say about that?
Robbie Peel was seen by a physician's assistant. This isn't an interview, this is like...
You want to talk about this?
There's nothing to talk about. Everything's... What's there to talk about?
Well, I mean, you're an anesthesiologist.
Physicians know that they have no authority to enable others who are unlicensed and unqualified to gain access to prescribed drugs.
The medical board says it is investigating Dr. Neitzes, physician's assistant Tony Bratton, and of course, David Regalia. In San Francisco, I'm Hank Plant for 5 Investigates.
We'll certainly keep you posted and bring you the results of the medical board's investigation as soon as it's completed.